Many of us are very frustrated and nervous when we hear about Michigan's latest COVID surge, and we wondered how frontline workers are feeling about the dramatic rise in the numbers. Our Paula Tutman caught up with a nurse who's gone from a Super Bowl high to a new COVID low, and that nurse has a message for all of you.
It doesn't take long for a dream to fade when you're a nurse attending COVID patients in a hospital. This was Carol St. Henry, a nurse anesthetist at St. Joseph Mercy in Pontiac almost 2 months ago to the day. February 7th, she was basking in the warm sun in Florida with a personal invite to the Super Bowl by the commissioner himself for being a frontline worker.
And I actually got a letter back from Mr. Goodell because I sent him a thank you for having me there, and he sent me a thank you for the thank you on letterhead with his name signed to it.
But today feels like forever ago. In February, the vaccines were rolling out, the numbers were going down. There was hope within sight. But with the recent surge in cases, that hope has slipped below the horizon.
You know, I talked to a friend of mine who's a physician. She looks at me and she's like, I've got 20 patients again. So, you know, it's like, oh my God, will we catch a break from this?
At the 5 hospitals in the St. Joseph Mercy system in southeastern Michigan, the numbers are dire. Dr. Anu Milani is the infectious disease physician and the medical director for infection prevention and control for the St. Joseph Mercy Health System.
As of a couple of weeks ago, we had less than 20 patients hospitalized. We were probably in the 10 to 20 range. Now we're in the 80 to 90 range of patients that are hospitalized, specifically in Ann Arbor. Those numbers are going up every day.
From 2 weeks ago, they went up from, I believe we had about 8 people here, single digit. Now 2 weeks later, we're at 50. So you're hoping that trends down again, but spring break happened.
And it's hard to wrap your head around.
It's exhausting. Oh my God, not again. Like, why can't people just wear a mask?
The hospitals are filling up. Younger and younger people are occupying those beds. People are dying again. And the frontline workers who've done all they can to get their communities to a place where they can vaccinate and suit up against the virus are watching helplessly as some choose not to arm themselves for the fight.
It's not political. It's here. People are still dying of this. It's very serious. Let's just get vaccinated if you can.
These doctors and nurses I spoke to acknowledge that the public has COVID fatigue and they are exhausted too. But they also want to remind everyone that COVID-19 doesn't care. Paula Tutman, Local 4.